Welcome everyone to our town hall webinar today in conversation with the Surgeon General, the latest on COVID-19 children's vaccine, boosters, and combating misinformation. The CDC Foundation is so pleased to host this webinar in cooperation with the Vaccine Equity Cooperative and Health Leads. This webinar is the 8th in the series and is part of our ongoing work and commitment to support those of you working in communities and partnering with communities to fight this pandemic. I am Dr. Lisa Waddell, the Chief Medical Officer for the CDC Foundation, and will serve as today's webinar moderator. Now, before we begin our conversation today, there are a few housekeeping items we'd like to review. Today's webinar will be recorded, sent to everyone who registered and uploaded to the CDC Foundation's CBO Resources website. During today's webinar, we'll have time to answer as many of your questions as possible. Please submit all of your questions using the Zoom Q&A button found on the bottom of your screen. You can also use the Zoom chat feature to share comments, reactions, and links with your fellow attendees and panelists. This webinar also has closed captioning available. To enable closed captioning, please click on the closed captioning icon on the bottom of the Zoom screen. Last but not least, at the end of this webinar, we will be launching a poll and evaluation survey. So please take the time to share your feedback on today's webinar and suggestions for future offerings. Now, we all know that this pandemic has taken a terrible toll on the health and well-being of so many, and that includes our children. Far too many children have been sickened by this deadly SARS-CoV-2 virus, and sadly, too many have died. And it remains to be seen how many may be impacted by the long-term consequences of this virus. But the long-awaited prevention tool, the vaccine, is now here and available. The vaccine rollout for children ages 5 through 11 is well underway. The vaccine is also available for adolescents. Booster shots are now approved and recommended for everyone 18 and older. If enough people get vaccinated, we will get through this pandemic faster and lives will be saved. But misinformation continues to be a barrier to vaccine confidence. And yes, the pandemic continues to evolve, and we know that the Omicron variant is also on your mind. So today's webinar will cover all of this. It will focus on the latest of COVID-19 children's vaccine, boosters, and combating misinformation, and questions that you have about the Omicron variant. To do this, we are thrilled to have a number of expert speakers on these topics with us today. Links to their bios could be found in the chat. So later today in the program, we're going to hear from Dr. Janell Routh. She is a pediatrician and the co-lead for the Vaccine Implementation Unit of the Vaccine Task Force with the Centers for Disease Control and Prevention. And to get us started, our town hall webinar will feature a fireside conversation with Dr. Judy Monroe. She's a family physician, a former leader at CDC, and the current president and CEO of the CDC Foundation. Dr. Monroe will be talking with Dr. Vivek Murthy, our 21st United States Surgeon General, the nation's doctor, as he addresses many of the questions that you all have sent in advance of this webinar. So just a few words about our special guest. Dr. Vivek Murthy was confirmed by the United States Senate in March of 2021 to serve as the 21st Surgeon General of the United States as a returning role. As the nation's doctor, the Surgeon General's mission is to restore trust by relying on the best scientific information available, providing clear and consistent guidance and resources for the public, and ensuring that we reach our most vulnerable communities. Dr. Murthy has many accomplishments in his career, and you can read all about them in his full bio. But I do want to highlight this. Prior to his tenure as Surgeon General, Dr. Murthy co-founded a rural health partnership that trained women in South India to become community health workers and educators. He has cared for thousands of patients over the years and trained undergraduates, medical students, and medical residents. He is a renowned physician, research scientist, entrepreneur, and author. Dr. Murthy is among the most trusted voices in America on matters of public health. We are thrilled to have you with us today, Dr. Murthy. This audience is so excited to hear from you. So Dr. Monroe, I'm going to now turn the mic over to you to facilitate this conversation with our United States Surgeon General. Thank you.
Thank you, Dr. Waddell. And Dr. Murthy, it's so great to be with you again. Great to see you.
So great to see you as well, Judy. I'm so glad we're doing this.
Yeah, I know the audience is excited about this, and so we're going to jump right in with I think the burning question and then the topic that is top of mind for everyone, and that is the new COVID-19 variant, the Omicron. So do we have any new information that you can share on this variant, and how does this new COVID variant affect the efficacy of the vaccines overall?
Yeah, it's a great question. So let me summarize where we are. And I know there have been a lot of headlines about this in the papers. It's being covered, pretty much wall to wall, it feels like, across local and national media. So I'm sure folks have heard about it. And I just want to recognize it. On top of everything we've been through over the last 22 months, the prospect of a new variant arriving on our shores can feel frustrating and exhausting to many people. So I just want to acknowledge that that's okay if you feel that way. It's very, very normal. But I also do want to remind you that there's still a lot we don't know about the variant at this moment. There are plenty of people with plenty of opinions out there, and it's always worrisome in these moments where there are open questions that sometimes people can speculate in ways that make it seem like we know more than we do, and can do so in ways that can be scary. But here's what we know, here's what we don't know. This new variant was first identified in South Africa by a truly remarkable team of public health experts and leaders there who have been incredibly forthcoming and transparent with us in terms of the data that they're finding. What they found in their investigation was that this new variant has an unusual number of mutations, and a number of them are sort of involve the region of the virus called the spike protein. And it's because of the location and number of these mutations that it started to raise concerns among scientists about whether this might in fact be evasive in some ways or less responsive to some of the vaccines and therapies that we have. Now, keep in mind one thing, we have seen other variants before that have had different sort of levels of protection, if you will, or evasiveness from our vaccines. But what we've seen across the board with all of those variants to date is even though there's variation within how much protection the vaccines offer, they still offer a good amount of protection, particularly against hospitalization and death with those other variants. Now, what will happen with the Omicron variant remains to be seen. But all that just to say that there have been times in the past where people said, oh gosh, the vaccine's not going to have any efficacy against this variant that's coming down the pipeline. And it turns out that that hasn't been the case. So we've got to wait for the data to come in to understand truly what the impact is. If there is a reduction in efficacy with the vaccines, how much of a reduction are we talking about? Those are the open questions that we have to understand now. And it'll take on the order of a couple of weeks to get that information, because what they've got to do is plow through a lot of data and understand, sort of stratify that data, if you will, between who's vaccinated, who's not. Are there differences they see based on people's ages, based on prior infections? So there are a lot of variables that they're actually looking at right now. There are two other questions that are open that they're digging into and that other researchers around the world are looking into. Number one is the question of, is this more transmissible than the Delta variant? It's certainly, there's some concern that it may be given how rapidly it's spread. But keep in mind that in South Africa, at the time that this variant took off, there was very little infection around in terms of active cases. They had experienced a significant surge with Delta, but there was very little infection at the time. So the question of, is this outcompeting Delta is it's hard to know, because it wasn't like there was a lot of Delta and all of a sudden this came and took over and drove the amount of Delta down. There was just very little infection around at that time. So open question there. The third and final open question is around the severity of illness that this causes, and a question of, does it cause more severe illness than other variants that we've seen before? Again, there too, I would caution you against some of the anecdotes that we've been reading. There are some spot anecdotes which have said, oh, this only causes mild infection. Others have said, which it seems to cause more severe infection. Others would say it seems to be the same. The bottom line is we don't know yet, and we've got to look at the data in aggregate. So those are three big unknowns: severity, transmissibility, responsiveness to vaccines. But everything that we have learned to date has told us two critical things. One is that the vaccines likely still afford some level of protection. And so if you're not vaccinated, we certainly want people to get vaccinated, in part because there's still a lot of Delta variant in the United States right now. But if you're also vaccinated but not boosted yet, you should get boosted, because what we've seen with other variants which seem to evade some of the protection is if you get antibody levels high enough, you can sometimes overcome some of those differences between the variants and afford a high level of protection to people regardless. So the boosters we know do increase those antibody levels. I think about the antibodies as the army that our body has. With the booster, you in a sense, you boost the number of soldiers, if you will, that can fight the infection and hopefully overwhelm the infection if you encounter it. So getting vaccinated, getting boosted, more important than ever. And just to remind everyone, if you're 6 months out from Pfizer or Moderna, you can get boosted. If you're 2 months out from J&J, you can get boosted. The second big thing, though, that remains true today, just as it was true last week and last month, is that the measures that work to protect you from spread also still work. Wearing high quality, wealthy fitted masks, ensuring that you're using sort of appropriate hand hygiene, especially when you're out and about, traveling, or engaging with people outside your household. And the third is recognizing that also the testing can be used strategically to reduce risk. A lot of people got together over the holidays with loved ones and were wondering, how do I reduce risk? Well, there were layers of protection that they took in addition to getting vaccinated and boosted if they were already got their primary series. Sometimes doing testing before you gather can help as well. I'll tell you, that's what we did in my family. We got, I live in Washington, D.C. My parents live in Miami, Florida. We wanted them to come and see their grandkids. They were more excited about that than seeing us. That was okay. We didn't take any offense to that. But they wanted to see their grandkids. We wanted to do it safely. So what we did, recognizing we had 2 kids at home who were not fully vaccinated because of their age, we had my parents who were vaccinated and boosted come. We tested, they reduced their risk for about 10 days beforehand. We tested them when they got there. And all of that gave us a higher level of confidence that they could interact with their kids and there would be little risk to our children. So anyway, that's sort of a summary of what we know. People should know we're in constant dialogue, though, with health experts in South Africa and around the world. And as soon as we get clear, definitive information to answer some of these key questions, we're going to make sure the public knows as well.
Yeah, that's a terrific overview. And I love that extra precaution of getting tested, even though you're vaccinated, and especially with children that maybe aren't vaccinated just yet, which actually leads me to the next question. So we've seen in the last few weeks a lot of updates on the vaccine rollout, and including the authorization for our 5 to 11-year-olds and booster shots for everyone 18 and older, as you mentioned. So can you share where we are on this vaccine rollout and where do we still need to go? Are you muted?
It's been a really exciting moment, Judy, because we have been waiting, so many of us parents of kids who've been under 12, for a vaccine to protect our kids. We've watched them go back to school. We've watched, them in some cases miss family gatherings, and we wanted that vaccine to be able to protect them. And finally, as of a few weeks ago, we had that vaccine. In the last couple of weeks, more than 4 million kids in the 5 to 11 age bracket have actually gotten vaccinated. That's a big deal. And that's in fact well more than 10%, because there are 28 million children who fall into that age range. So in 2 weeks alone, we've exceeded 10% of that population. That's great. But we've got to keep going because we know that there, again, is a lot of Delta around. We know the cases have to start to tick up again as cold weather approaches, people go indoors, the virus is more easily spread in cold, dry air. And so making sure that we get our children vaccinated is critical. Some things we've been doing to make that possible is, number one, we've been working hard to expand the number of access sites. So we have thousands and thousands now of access sites around the country, pharmacies, a growing number of doctors' offices, pediatricians and family doctors that have the vaccine. We have mobile units that are crisscrossing communities around the country to take the vaccine to where people are. In some places, we're setting up school-based events as well. And we have a lot of funding for schools if they want to have a vaccine clinic We're doing the same thing with children's hospitals, where many of them are partnering with us to set up vaccine clinics. We're doing a lot of this because we know that parents generally want to go to places that they're familiar with and that they trust, like their doctor's office or their school or children's hospital, to get vaccinated. So we want to make sure that they have options when it comes to getting their child vaccinated. So the last thing I'll just say on this is we've been working hard to make sure parents have access to accurate information about the vaccine. Sadly, one of the things we've seen during this past year of trying to vaccinate the country is that there's been a lot of misinformation floating around, which sadly has misled people about what the vaccine's about and about whether or not to get it. Now, I've always believed as a doctor, people have, can make their own decisions based on their values, based on, what they and their families think is best. But I also believe that everyone has the right to have accurate information so that they can make their decisions accordingly. And unfortunately, that has not been true for everyone. We know that a lot of this misinformation people are encountering on social media. And so we've been certainly pushing the companies to step up and be sort of more active, more engaged, frankly, more responsible when it comes to reducing the amount of misinformation on their sites. But finally, this is where all of us come in. Because when you look at the polls of where people get their information, who they trust, there are two things that have stood out to me over the last year that people consistently said. One is that they often want to talk to their doctor to make a decision about what's best for them, the person who knows them, knows their children. But the second thing is people say that they often want to talk to their family and their friends, people they know and trust, to make a decision. Now, that's the case whether their family and friends are medical experts or not. So what that means to me is that all of us, regardless of our background, have the power to bring accurate information to people in our lives to help them make a decision based on facts, and the decision that's best for them. So if you've got a family member out there who his children is thinking about what to do, encourage them to talk to their doctor. You can also direct them to credible sources, whether that's your children's hospital, whether that's their local health department or the CDC, to get science-based information about the vaccine. And if you're somebody who's vaccinated your child, one of the most powerful things that you can do is to share that story with people in your network, because people often feel a lot more comfortable doing things and taking steps if they know people around them have done that. That's actually one of the big reasons why we started to see vaccination rates among adults increase, is more people had a chance to talk to their doctor, but also saw their family and friends getting vaccinated.
Yeah, no, that's terrific advice. And we all need to remember the power that we all have as individuals with those relationships. So you've published a toolkit on health misinformation. Is there more that you can share with us about the toolkit?
Absolutely. Yeah. In July, we published a Surgeon General's advisory on health misinformation and followed that up a couple of weeks ago with a community toolkit that has practical tips and advice and worksheets and other tools that people can use to both recognize misinformation when it presents itself, but also to have conversation with family members about misinformation. Because it's not infrequent that you might actually get a piece of misinformation from a family member shared on a text thread or shared on a social media platform. And there's always that awkward question of, what do I do, right? Do I say something? Will I offend them? But then I don't want misinformation to spread. Maybe that could harm other people. I think a number of people encountered this over Thanksgiving when they were getting together with family around the dinner table, and topics like this come up. Hey, do you get vaccinated? And people share the information that they've encountered. So we have tools that help people to have these conversations. And I'll just tell you that one of the things that we often encourage people to do is, number one, to have the conversation. If you see a family member sharing misinformation, recognizing that a lot of times people aren't doing this intentionally because they're trying to harm people, but they see something, they think, hey, this sounds concerning, maybe I think it's true, and they share it with family and friends to try to warn them or protect them, not recognizing it could actually do more harm. So having the conversation is important, but how you start that conversation matters too. And starting not with judgment or blame, but by asking and by listening is actually the most important thing to do. Because you don't know what's motivating people, what they were thinking. Maybe they did talk to somebody else about it and we're told that this is true, but it actually isn't. The second thing, we tell people in having these conversations, in addition to starting with listening and non-judgmentally, is to share your own experience and to do that not as a counter or as a threat, but just as information sharing. And then the third is to try to guide people toward accurate sources, whether that's their doctor, whether that's the local health department or children's hospital or the CDC. But engaging is really important because, if we all do this, and if we're also careful about what we share, we raise the bar in a sense on what we share, not share unless we sort of have a high degree of confidence that the source is credible and accurate, that's also another way that we can help reduce the spread of misinformation. And the toolkit you can find on surgeongeneral.gov. We're hoping that not only would individuals use it, but the people who lead organizations, whether they're teachers, whether they're community-based organization leaders, and many of the folks on this call, that they will take it and share it with the people in their organization. We have groups that have committed to doing trainings, clinician groups, librarian groups, and others who have been great partners, recognizing that they've got great power to train people in digital health literacy, which really, if you think about it, is a skill we all need in the 21st century.
Yeah, well, that's terrific, because we know our community-based organizations listening in today and our public health departments have really had a difficult time combating the vaccine misinformation. So thank you for all of that. So going back to vaccines, so it's not just adults who have questions about vaccines, but children do as well. And Dr. Murthy, you're a parent and a practitioner. Can you share with us any recommendations or guidelines on how to honestly and respectfully answer the questions our young children may have to reassure them about vaccines?
Absolutely. I'm glad you asked, because kids are an important part of this conversation. And it's not just about talking to their parents, it's about checking in with them, particularly with adolescents. We know that adolescents are encountering information independently from their parents, and that they're formulating their own thoughts and views about COVID and about the vaccine. So really important that we engage them. But there are times where we found that sometimes it's the adolescent who wants to get vaccinated, but maybe their parents aren't sure or have concerns. And it's been actually the young person who has actually pushed and said, no, we got to do this, and help educate their parents about it. So let's just never forget that young people can be a powerful source of information and decision-making. With kids also, the second thing that I would also encourage people to remember is that they actually process and understand a lot more than we may think. I'm reminded this often as a dad of a 5-year-old and a daughter who's almost 4. The other day, I came in and I heard my 5-year-old explaining to my almost 4-year-old that there were different vaccines, that there was a Pfizer vaccine, and then there was a Moderna vaccine, and then there was a Johnson & Johnson. And I was listening, oh my God, he's been listening to his mom and me talk too much on conference calls. That must be what's going on. But he had absorbed a lot of that, and she had too. So I just wouldn't underestimate how much children understand. The third thing I would recommend is that you try to help put the vaccine in terms of not what's contained in them or the mRNA or this or that, but more so in terms of what does a vaccine allow your child to do? Because kids are thinking about it in that way. Okay, if I get this, how's my life going to change? Does it mean that I can do things more safely? Can we go see grandma and grandpa for the holidays? What are the ways in which a child's life might be different? Being able to speak to that is really important. And not just to what a child can do, but what will be easier and less stressful to do. Because one thing I think that all parents know out there is our kids pick up on our stress, right? They pick up on our anxiety. And to know that, okay, we can go visit grandma and grandpa, but we'll be less worried because we think it'll be safer. And so mommy and daddy will be less worried. That means something to a child as well. So these are some simple things, but I would engage children in that conversation because they may surprise us. And finally, I would just remember that if you're trying to motivate your child to go the last leg and actually get the shot, that little rewards never hurt, whether it's a treat or a sticker. My son, decided he was actually excited to get the vaccine because he knew it would protect him. It would make it easier for us to do activities with friends and family. But when the time came to get the vaccine, he like his dad, doesn't love needles, so he was kind of pulling away. But I'll tell you that when we showed him the sticker that he would get if he got a shot, he was on board, and he proudly displayed that sticker to people for days and days after the shot. So anyway, kids are an important part of the equation. Those are just a few tips as a dad for things that might work with your kids.
Oh, that's great. Well, I was actually pretty proud of my sticker with my first COVID vaccine. So let's shift a minute to rural communities. Any unique? Certainly, there are unique challenges in rural communities. I was a rural practitioner when I first came out of my residency. So, any initiatives that would help vaccinate the 5 to 11-year-olds in the rural communities specifically?
Yeah, a really important question. And one of the things that we've been doing during this vaccination campaign is to partner with rural health clinics. In some cases, we've gotten actually vaccine directly to them. We know that a number of the community-based health centers and FQHCs, which function in rural areas, are also an important part of this equation. That's why we, with FQHCs in particular, have gotten vaccine directly to them, for much of the vaccination campaign. And so I think these are going to be really important channels for us to engage in. It's also in rural areas, we know that often the local school is an important center of activity, whether that's for youth sporting events or for other social and community gatherings. And so partnering, we put funds toward actually being able to fully reimburse for measures that are taken to set up vaccination clinics in schools, for example, in such settings. So I would really, we're pressing on that, but we are certainly always eager to work with local health departments, with state health departments to set up more of these local vaccine clinics. So I just want to offer that, as just being another pathway. And finally, we, from the beginning, including on this, have, said that we are very open also to setting up larger scale vaccination events if a community feels that would be helpful. We have sent federal personnel to support those kind of efforts all over the country for the past year, and are certainly happy to keep doing so.
That's great. Well, thank you, Dr. Murthy. And so now at this point, actually, I'd like to bring Dr. Routh from CDC into this conversation with us. So Dr. Routh, you can join us, and welcome. And I'm going to toss a question your way. So how can we reassure parents that the vaccine is safe for children 5 to 11, and that the trials have shown that there's a good number of children that have been tested and they can feel confident about the vaccine for their children?
Dr. Monroe, thanks for that question. And I'll probably repeat a lot of Admiral Murthy's eloquent remarks about talking with families and with children. As a pediatrician, I definitely recognize the importance of meeting families where they're at. I think each family that comes to us is unique in their, along the process of their decision-making process. And so meeting them where they're at with accurate information is just incredibly important. So I really start with the safety and effectiveness of these vaccines. Both have been extensively studied. CDC and FDA have really thoroughly reviewed the information about both efficacy and safety in a very transparent manner for the vaccines for children, the Pfizer-BioNTech vaccine. We know that these vaccines have undergone and will continue to undergo the most extensive safety evaluation really in our history. We have multiple platforms that look for safety signals for these vaccines. And so I really do feel like parents should be reassured that we are constantly monitoring to see if any adverse events do arise with these vaccines. We know the clinical trials that Pfizer-BioNTech did for the pediatric age group included over 3,000 children and looked at how effective that smaller dose was in boosting immunity amongst this age group. And I think that's one critical piece to emphasize to parents is that this is a smaller dose, a third of the size of the adult dose. So meant for children. And but smaller doesn't necessarily mean less powerful. So we know even in that smaller dose, children's antibody levels rose to the levels that we saw in both adolescents and adults. The Advisory Committee on Immunization Practices, so that's CDC's advisory group, did meet again to thoroughly review the evidence around effectiveness and safety. I think among the benefits that they saw with these vaccines were obviously the reduction in COVID-19 illness. We've had over 1.9 million cases in children since the pandemic began, and certainly a huge factor in wanting to find a safe and effective vaccine for this age group. Moreover, reducing hospitalizations, over 8,000 in this age group, and the risk of multi-system inflammatory disease in children. This is an inflammatory condition, a really serious consequence of COVID-19 infection that affects younger children. So decreasing that certainly was an important benefit for the vaccines. And then finally, just, allowing children to get back to the things that they love to do, to improve both mental health and their social, emotional well-being, getting back to school, interacting with friends and family members, weighed very heavily in the ACIP's decision. They certainly balanced that with the risks. So we know there are risks of adverse events with these vaccines. Particularly, I know people have heard a lot about myocarditis. So balancing those rare adverse events and also the more common reactogenicity that we see really 1 to 2 days after the first and second doses, making sure that those are not more serious in this age group. But I think overall, the deliberations really found overwhelmingly in favor of the benefits of these vaccines. And we will continue to monitor their ongoing safety. We know that side effects generally with vaccines generally tend to occur in the first 4 to 6 weeks. And so that's an important point I'd like to stress with parents. I know we often want to think about the long-term effects, the unknown, what can happen, but really and truly most vaccine side effects happen within that short period of time after vaccination. Using that as some data to reassure parents, I think is always very important as well. So that's really where I begin with the conversation. It's the data, the facts that we have in front of us to show that these vaccines are both effective and safe for use in this age group.
Yeah, thank you for that. And I'm going to shift gears a little bit and talk about, ask you about boosters, because we've got now CDC recommending everyone over age 18 and older should receive a vaccine booster. And so give us some talking points to answer people's questions on the booster shot formulations, and if this means the vaccine isn't working.
Yes, well, first, maybe I'll just start off by saying that these vaccines are truly some of the most effective that we've ever developed. We know that for both Pfizer, BioNTech, and for Moderna, they're both over 95% effective in preventing COVID-19 infection. And that those who are vaccinated and may get a breakthrough infection, they're still very protective against severe disease and complications. So, even if you are one of those breakthrough cases, we know that disease in the fully vaccinated is much more mild. Ongoing surveillance that we've done across the United States to look for infections has shown us that immunity does wane over time. And that immunity, what we're really looking at is the decreasing in antibody levels over time. And Dr. Murthy, I think you described very nicely how having a high level of antibodies in the blood can really help overcome even those small mutations that might occur with the various variants that we've seen over the past couple of years. So keeping those antibody levels high is important. And that's where boosters come in. So that's essentially why we're recommending boosters, not because that primary series has lost its effectiveness, but because maintaining those levels of strong immunity is really our best defense against the virus and the variants that we're seeing now.
Very good. Yeah, so boosting the defense. So at this point, first of all, thank both of you. Time flies when we're in a great conversation. I'm going to turn back to our moderator, Dr. Waddell, who's going to facilitate our Q&A from the audience. So Dr. Waddell, I think you come back on and...
I love it.
Oh, good.
When we have our special guests, including our furry ones. So look, this has been a great conversation. Thank you, Dr. Murthy, Dr. Monroe, and Dr. Routh so much. So many pearls of wisdom already shared about sharing your stories that are very impactful, knowing that you have the power to bring accurate information. Talking to our children about what a vaccine allows them to do and get back to. Get vaccinated, get boosted, wear a mask, practice your hand hygiene, utilize testing as recommended. So, and that the vaccine for children is safe and effective as it is for our adolescents and adults. So fantastic pearls of wisdom coming from our experts thus far. So now we're really excited to engage in some more questions and answers and involving all of you. Again, we know that community-based organizations have been so important and critical in this response during this pandemic, and have therefore played a very important role in the vaccine rollout. So we're going to start out our question and answer period by inviting Gary Drews, who is the president and CEO of 9Health 365 in Colorado. It's a community-based organization that focuses on screening and health education, and during the pandemic has played a key role in distributing vaccines in Colorado, which has even included organizing a vaccine clinic for children ages 5 through 11 at the Denver Zoo. So, Mr. Drews, thank you for joining us today, and we're going to let you kick it off with our first question for Dr. Murthy.
Thanks so much, Lisa. I hope I can be heard okay here. Thank you. And Dr. Murthy, thank you for your leadership during this time. It's been priceless, and I want to give a huge shout out to all my community benefit organization colleagues and public health colleagues that we're working alongside every day at this point. For 9Health 365, we're fortunate to have been around for many decades as a community service organization providing preventive health screenings across the state, and we have an enormous amount of trust in this organization and in the 17,000 volunteers that we use. It's through that work that we've been able to vaccinate over 50,000 folks in underserved communities so far, and a huge thanks goes out to the CDC Foundation for supporting that work. And it strikes me in doing this for the past year that organizations like this can really be strategic operating partners for public health offices. That the funding for public health offices may come and go, as does for nonprofits as well. But what I've really learned is that if the infrastructure isn't there during a time like this, then we don't have a leg to stand on, and we have to restart things up from scratch. And so even with all the challenges we've been through in doing this work, we struggle with the hard guardrails, if you will, of society's vision right now. And so we've been talking about tactics here, and it's all great information, and we use it, and we sure appreciate the toolkit. But I'd love to go back to what you said about your kids, Dr. Murthy. We did run an event at the zoo recently, and two 10-year-olds got up to speak while the governor was speaking and implored to us adults to get vaccinated, and telling us that it didn't even hurt. And so they were cute as heck, but my fear is that they're not enough as maybe the most important influencers of all to really overcome that division. And I'm wondering if you could just take a moment, and from what you've seen during this pandemic, speak to what the systemic levers are versus the tactical ones that a community benefit organization like ours could undertake to change this division so that all of this ends a little bit sooner, because it sure doesn't seem like it's going to end anytime soon. So systemic levers we could put to use?
Well, Gary, it's a really great question. And first of all, thank you for the incredible work you've done to get 50,000 plus people vaccinated. That's truly extraordinary. And my only wish is that I was a young boy when you were organizing this zoo vaccination event, because I would have loved to have gotten vaccinated.
Come on out, we'll take you over.
Thank you. But yeah, I think you're asking the right question, which is, unfortunately, we've seen how in a polarized environment that is rife with misinformation can divide people further, and what should be an endeavor to save lives can suddenly become a very divisive experience, whether it's trying to get people vaccinated or trying to get them to take precautions like wearing masks. And so I think there are a few things I think that can help just at a systemic level. One is that we know that the easier that you can make getting vaccinated, the more barriers you can knock out of the way. easier it is for more people to actually step in. So building it into their lives, and that's where we've worked hard to get mobile units up and other types of and provide free transportation and have more locations, et cetera. But if people are spending the majority of their time at work, or if their kids are at school, and being able to take the vaccines to them, I think is one way to knock down some barriers. I think the second thing that can be very powerful, just at a systemic level, is recognizing that people take a lot of their cues from their family and friends, right? So are there incentive structures or other things that we can build in to make it easier for people to bring in family and friends? For example, like one of the things that we've been talking about more and more that's already being implemented in some parts of the country are family vaccination clinics, right? Where you can come to vaccinate your child, but then if you happen to be unvaccinated, you can get vaccinated. If you're coming in for your doctor's appointment, then with your spouse or with a friend, and they're not vaccinated, and they can all get vaccinated at the same time. But making sure that we have the opportunity to vaccinate people sort of together, whenever they are together, is incredibly important. I think the other thing I would just mention is when it comes to the polarization itself and the misinformation, we have to find ways to provide people information from sources they trust. Now, some people may trust their local health department or the CDC or other sources, but not everybody trusts state, local, and federal government, right? Some people may have much more faith in their faith provider or in their local doctor or in their family and friends. And so thinking of broad efforts through which we can, for example, engage our faith communities in talking about the vaccine, sharing more about the vaccine, important benefits of getting vaccinated is important. We've been doing a lot of that through the COVID-19 Community Corps, which a number of you are part of already. But often these efforts are best when driven actually at a community level. And so these are all ways that I think we have to go about thinking about how we not only bring the vaccine to people, but use sources that they trust to systematically get accurate information to them, and to use the power of example as well. People, family and friends getting vaccinated to increase their likelihood of showing up and getting vaccinated too. Look, finally, I'll just say this, the requirements that many people have seen as well, vaccine requirements in universities, in workplaces, in hospitals, in healthcare settings, in various levels of government, including the federal government. These are a systemic tool that actually work. They actually work to improve vaccination rates. We know that because we've required vaccines in the past, right? For kids going to school, we've been doing that since the 1800s in many parts of the country. The military has required vaccines for a long time. Many people in the workplaces like hospitals have been required to get the flu shot, the measles and mumps and rubella shot, hepatitis B vaccine, and other types of vaccinations. So these aren't new, but we know from experience that they work. I recognize that they can, in some quarters be controversial in a moment like this, but they are actually in keeping with much of our history and how to get the country vaccinated and protected against disease.
Thank you very much, Dr. Murthy.
Thank you, Mr. Drews. We really appreciate all that you're doing. And certainly there are zoos all across this country. So certainly as we share things that are working, this is an opportunity for, I'm sure, many of our community-based organizations to consider what you all have done there in Denver. And certainly family vaccination clinics and the opportunities, again, to take advantage of all of those points of care are really important. So Dr. Murthy, a question for you. We've got some interest in when a vaccine for children under the age of 5 might be available. Do you have any insights on that?
Well, great question. And I have a personal interest in that question too, since I have one child under 5. My daughter is almost 4. And look, we don't have one right now, but I'm hopeful that in the early part of 2022 that we will have a vaccine. I think there are a few steps that have to fall into place. The trials that are underway right now have to be complete. The data has to be analyzed. And then the companies that are conducting those trials need to then submit that data officially to the FDA. The FDA then needs to review it. They'll convene their advisory committee. The CDC will do the same in convening its advisory committee. And then both the FDA and CDC will then make their official authorization and recommendation. So it seems like a number of steps, but one thing I can tell you is that if you look at the last few rounds we've had, where vaccinations had to be made available, whether it was children's vaccines or whether it was the booster shots, what you saw is that the FDA and CDC actually, once they received the data from the companies, which is what they needed, they moved actually remarkably quickly in analyzing that data, in doing it thoroughly, not cutting any corners, because everyone wanted to make sure that every single requirement and box was considered and checked when it came to making sure that these vaccines were safe and effective for our kids and certainly boosters for adults. But they moved quickly because they prioritized vaccines for COVID-19, and that priority remains the same. So I feel confident that when the companies finally submit that data, that they will move quickly through the regulatory process, and then a decision will be rendered. There's one thing I just wanted to say, actually, on a completely different note, but I would regret if I didn't mention this at some point in this conversation. Captain Routh, as you noted, is wearing a uniform, and so am I. And it's because we're both part of the United States Public Health Service Commission Corps. Some of you may know the Commission Corps because you may have officers in your local communities who you've encountered who are helping with various public health efforts. But the 6,000 officers who are part of the Commission Corps, including Captain Routh, have deployed thousands of times in an effort to address COVID-19 over this past 22 months. That means everything from going all over the country to help with the vaccination efforts, to help with testing campaigns, to help support local departments of health, to helping in the many roles that are needed within the federal government itself. And they've deployed all across the federal government to make sure that the response effort is what it needs to be. And so for me to be here, to be serving in this office, wearing this uniform, representing these officers is an incredible honor. But I wanted to specifically mention officers like Captain Routh and others, because we think of them as the silent warriors for health that our country is fortunate to have. But one of my goals as Surgeon General is to make sure that they're not invisible or silent, that people know about them as an important force for public health that's there protecting you, supporting you in your communities, and also an important partner. And one of the things that we want to make sure we're able to do in the months and years ahead is to make sure that people know the Commission Corps officers who are serving in their local communities. They can be extraordinarily powerful resources, not just for departments of health, but great spokespeople in schools, talking to kids, talking to parents about vaccines. They can be great voices on science and public health in churches and synagogues and other gatherings where we're bringing people together to learn about COVID-19 and the vaccines. So thanks for allowing me Lisa, to just talk a little bit about the Corps. It's such an important force for the country.
Absolutely. And thank you so much. And we appreciate, obviously, your service leading these 6,000 important dedicated public health professionals across the country, and for your service, Dr. Routh, as well as everyone. So a common question that's coming through is about boosters for those that are 16 years of age or older. Well, we know about 18 or older, so the 16-year-olds, but also for children. So we've got folks that want to get the kids vaccinated, but that are already thinking about the boosters. So can you speak to that?
Yeah, so it's a really good question. And I'll tell you why the question of some people are wondering, why just 16, 17-year-olds? Why is that in the news? Here's why it's in the news. When Pfizer first applied for authorization, was granted it for their vaccine, it was for individuals 16 and up. Which was unusual. Usually we think about 18 and up, et cetera, as a cutoff, but it was actually 16 and up, which means that there were 16 and 17-year-olds who received the vaccine, from the beginning of the vaccination effort. So Pfizer is now indicating that it is getting ready to submit a request with data to the FDA to extend the booster authorization to those 16 and 17-year-olds who are part of the original authorization. And as soon as the as soon as the FDA receives it, they will assess that, and then the CDC will opine on that as well. But this is an effort, again, as Dr. Routh said, not to intervene because the vaccines aren't working, but to extend the protection that people have been getting from the vaccine, which has been very strong protection. Kids, under 16, so the 12 to 15-year-olds who were, allowed to get the vaccine late spring, early summer. At some point when the companies submit data in their request for boosters for that age group, once again, the FDA and CDC will quickly consider that as well. The good news for the 12 to 15-year-olds is that because they started receiving the vaccine later, their protection is less in danger of waning compared to people who, let's say, got vaccinated in December or January. And so, this will all come in due time, but people should just know that this FDA and CDC are ready and waiting. As soon as they get that data, they will assess it and then render their decision on boosters for younger groups.
Great, thank you so much. So Dr. Routh, I want to bring you into this question and answer period. And we've got some questions that folks are asking about the long-term consequences. And we've got people that are interested in around, well, if I get the vaccine, I've got concerns, but perhaps maybe you can address this issue of what those long-term consequences are of not getting the vaccine, short and long-term, and speak to that issue, or speak to the things that people need to be concerned about potentially around long COVID.
Right, I think it's a very good point. I guess I would say upfront, what you need to be concerned with if you are unvaccinated is the potential likelihood of getting infected with SARS-CoV-2 and having a COVID-19 infection. We know certainly for adults that there are certain risk factors that make adults more likely to go on to develop complications, hospitalization, maybe even die from a COVID-19 infection. CDC has a good website that lists some of those underlying medical conditions that contribute to more severe disease. So I would definitely say, if you are an adult with some of those underlying medical conditions, that is something that you need to be thinking very seriously about and weigh that in your decision to get vaccinated. For children, it's even more interesting. We don't seem to know yet what risk factors make children more likely to go on to develop complications like that multi-system inflammatory syndrome I was talking about. And without knowing those risk factors, even though multi-system inflammatory syndrome is a rare outcome of COVID-19 infection, we don't know who it potentially could affect. And so I think that's another reason when you are weighing the risks and benefits of vaccines to think very carefully about vaccinating your children. Long-term consequences, absolutely. So I think we're starting to collect a body of evidence that supports this long COVID syndrome. And again, we don't have a lot of understanding about who is more at risk for getting long COVID. I think we've seen it in everything from, athletes to, to couch potatoes like myself. So, again, in weighing the risks and benefits of vaccination, those unknowns, I think, can play a real factor in tipping people in the direction of vaccination.
Great. Thank you so much, Dr. Routh. And so we're going to turn it back to Dr. Murthy for sort of your final words of wisdom and advice, and particularly to our community-based organizations. You've got a toolkit out there. There are resources out there. There are key things that people have questions that come up around sterility and fertility. And so how can your toolkit help? And tell us sort of your final words of wisdom for this nationwide audience today.
Well, thank you so much, Lisa. I don't know that I have any words of wisdom to add, but I do have a few observations and just a note of appreciation that the folks who are on this call from community-based organizations across the country, I just want to just recognize what an important role you played in our country getting through the last 22 months. There's often the federal government that's in the news. There's the state governments that are in the news. But at the end of the day, we know that when people are looking about and wondering who they can trust, who they can go to for help, they look at the organizations in their community, in their backyard. And those are the organizations that you lead and that you're a part of. And so you have been an important backbone of this response effort, whether it's helping people make sense of all the news that they're seeing, whether it's advising them, encouraging them to get vaccinated, whether it's helping them stay safe and wear masks, or supporting them as they struggled with not having their kids in school and dealing with food insecurity or with other concerns that we know many families had to deal with. All of that was possible because of you. You know, we have many different social safety nets in our country, but our community-based organizations are one of the most important safety nets because they do what government often can't do, what businesses often can't do, which is they show up where people are, understand their needs, and tailor responses to meet those needs. So I know that you will continue to be an incredibly important part of the effort going forward, and we need you to do that, because when it comes to getting, for example, people protected, we know that still, even with the Omicron variant in the mix, that getting vaccinated and getting boosted, if you're already vaccinated, is still going to be a powerful and important pathway to protection. But getting that word out to people, making sure that they hear from people they trust, that is where you have such an important and invaluable role to play. With all of this, I want to recognize that for many of you and your families, you've likely also had to deal with great hardship during this pandemic. Many of you may have lost loved ones, as I have, and I know a number of people have on this call. Many of you may have struggled to telework and homeschool your children during the better part of last year. Many of you may just be struggling with the uncertainty. And many people in our country have struggled with anxiety, with depression, with loneliness, with other mental health challenges in the course of this pandemic. And there's nothing to be ashamed of if you're one of those people. But the bottom line is that all of us have struggled. And so my hope for you also is that in the face of everything that you are doing and everything that you will do, I hope that you also will take some time to care for yourself, right? Whether that's a short break just to sit down and breathe, or whether that's a walk that you take, through your garden or in nature, or whether that's time that you spend with a friend, even if it's 5 or 10 minutes catching up over the phone. Those moments of solitude, those moments of connection, those are lifelines that sustain us during the tough winter that we've been through and the challenging days that may come forward. And finally, I'll just say this: as much as the outlook and the future can seem dark if you read the headlines and listen to the news, which, by the way, I would not advise doing a lot of, just in the interest of your health and well-being. But if you listen to a lot of the media, you can feel like, gosh, things are bleak. But actually, I feel more optimistic about where we are and where we're going now than I did a year ago. And I'll tell you why. It's because a year ago, think about it, we didn't have a single vaccine that was available that we could use to protect ourselves and our children against COVID-19. We were seeing cases starting to rise as part of our winter surge. I had no idea, whether they would be oral medications and that would be on the horizon, like we have 2 candidates now, but that might be able to significantly reduce our risk of bad outcomes. We didn't have more than 450 million doses of those vaccines administered, which we have now. There are a lot of reasons to be hopeful, and we've also learned a lot about how to get on with our lives and continue some of the things that really matter to us, including getting together with family over the holidays. We've learned how to do that in a way that's much, much safer than we understood last year. We now have the ability not only to wear good quality masks, but we also to use testing in strategic ways before we gather to reduce our risk even further. So the bottom line is we've learned a great deal about how to operate and live our lives during this holiday. And if you need any proof of that, look at Thanksgiving 2021 compared to Thanksgiving 2020. Look at Halloween 2021 compared to Halloween 2020. I'll tell you, for Halloween 2021 this year, my kids were dressed. They were running around trick-or-treating inside our building and outdoors. They were, unfortunately for me, hyped up on sugar for days and days after Halloween. But compare that to last year, when my kids and many kids didn't even go trick-or-treating because we weren't even sure about how to do that in a safe way. So the bottom line is we have made progress, but the single most important determinant of whether we move forward or not as a country and continue in that direction is how closely we stick together and support one another. The division and polarization that we are seeing in many corners and hearing about on the news, this is what keeps me up at night, even more so than COVID, because it is in the face of division, it's very hard for us to tackle big challenges, whether it's COVID or climate change or racial inequality or any other challenge that we're dealing with. It's only when we recognize that we depend on one another for a positive outcome, that we can't get through this pandemic alone, but that we've got to support neighbors, look out for family members, give people the benefit of the doubt, even if they have a different point of view from us. That's the only way that we get through these tough times. So as you look around your own community, I know so many of you have been sources and forces for unity and for bringing people together. And I just want you to know how vital that is during this time. You don't have to be a doctor or a nurse or public health expert to be a force for healing during this pandemic. You just have to have the willingness to reach out and listen and support other people, the willingness to have an open heart and an open mind, and a recognition that, as that old African proverb goes, if you want to go fast, you go alone. But if you want to go far, you go together. That's what you're helping us do. So just incredibly grateful for you. Thank you for giving me the chance to be with you today. And I'm looking forward to all that we can do together in the months ahead.
Well, Dr. Murthy, thank you so much. What I would say to everyone, there you have it. We have these phenomenal words that have been shared, and advice and guidance and resources from our United States Surgeon General. I want to thank Dr. Monroe. I want to thank Dr. Routh. I want to thank Mr. Drews, and certainly you, Dr. Murthy, for your time and your expertise that you've shared with this community-based organization audience, as well as public health departments and so many other partners today. We've just launched a Zoom poll, so please take a moment to fill that out, as well as an evaluation that will pop up when you exit the Zoom. It won't take but just a minute, and your feedback is so incredibly important because we want to ensure that these webinars, these town halls that we are offering for you are meeting your needs. So please take a few moments to do just that. We'll be sending a copy out of the recording to all who registered for today's event. And again, we thank you all so much for everything that you are doing. You're so vitally important. And we look forward to having you join us next time. Thank you.